Hi Jamie, and thanks for spending some time with us today. Can you tell us a little bit about what you do?
Absolutely. So I actually started to volunteer with St John Ambulance when I was 13. And through my time with St John Ambulance, I got exposed to a variety of opportunities around caring for people in the community, predominantly caring for people at major events or mass gatherings, and then also starting to care for people in disasters. So I went on parallel to my career in St John Ambulance as a volunteer to become a registered nurse. And it was in 2003 that I started to participate in the Canberra bushfires, and I helped set up one of our evacuation centres in Canberra at Erindale Sports Centre from a health perspective. So we found a squash court and we started to fit it out from a health perspective, expecting to see evacuees from the Canberra bushfires. That moment sparked a lot of my interest around disasters. Was I prepared enough? Did I know what to expect in disasters? How could I best care for people who presented to the evacuation centres in disasters? So that sparked a lot of my interest in disasters. I continued then to volunteer with St John Ambulance and assisted in the Victorian bushfires in 2009 and the Queensland floods in 2011. On both of those occasions I did a bit more of a high-level strategic role, and my role was to coordinate the movement of nurses and health professionals from other states and territories in Australia to those disaster-affected areas. Now, I was doing that at the same time as being a clinical manager here in Canberra at the Calvary Hospital Emergency Department. So I had some insight into what the interface was like between community and the emergency department itself. So I started to think more and more about what disasters were, what they were like, how people were affected by disasters, and what types of people we might see using health services and why they would use health services, and would we have enough capacity in our health services to assist if a disaster or pandemic occurred. So from that we started to do a lot of research. One of our interesting projects was around the willingness of healthcare professionals to assist in disasters. That is, if there was a disaster to happen, would healthcare professionals turn up to work to help? The short answer is maybe.
That's a really interesting point, because we've been talking to some of the emergency management people on the ground, and they were saying, for example, that when it comes to police and all of that, and their own families are at risk, how do they manage that choice to, do I rush off and save my own family, or does my role as a police officer, fireman, come first?
Exactly right. So we had the same findings as with nurses, particularly emergency nurses, in relation to disasters as well. In particular, if you're already at work, you're going to be involved in the disaster and people start presenting to the emergency department as a result of that disaster. The interesting part there is, the first time that the emergency departments normally find out that a disaster has happened in the community is when people first start to arrive in the emergency department. It's not normally through any other official communications or channels that we hear about the disaster. It's normally because someone presents.
So what you see on ER is in fact not correct.
That's right. Or it might be that, the Canberra bushfires as an example, people started to present the day before the official disaster emergency was declared with things such as smoke inhalation, for example. So patients were already starting to present, trickling into the emergency department, and then the day of the bushfire there was obviously a large peak in presentations. So patients normally present to the emergency department is the first way that we find out about a disaster. The way that they get there is interesting as well, so they don't always come by ambulance. Some of the sickest patients in a disaster come to hospital by private cars. We know that the emergency services in the community, because it's a disaster, are going to be stretched. And just by the definition of disaster means that the capacity of the health services are overwhelmed. So we know that most people are going to present by private car or find their own way to the emergency department. But you've got to have the nurses, the doctors and people there to assist in the disaster. So coming back to the willingness stuff, if you're already working in the emergency department, you're likely going to be there and willing to assist. If you're not in the emergency department, you need to make some choices about whether you would assist or whether you would not assist. Unlike some other countries don't have that privilege. If the disaster happens, you just have an expectation, morally and ethically or whatever, that you'll turn up. In Australia, we have a bit of a choice. So the choices are normally made around these types of issues. One, Do you have loved ones at home that you need to care for? Do you have pets at home that you need to care for? If you have dependents such as children or elderly parents, what do you do in a disaster when you have them? Because you're also not thinking about yourself, you're normally thinking about those people in that family unit. Other things that influence your willingness to assist in a disaster, maybe the type of disaster. So we found that nurses were more likely to assist in a disaster if they knew it was a conventional type of a disaster, that being a bushfire or a flood, in comparison to a non-conventional disaster, such as a pandemic or epidemic, some unknown respiratory illness. They were less likely to be willing to assist in those occasions.
Is that because they think possibly that they could catch it, or...?
Yeah. I think it's also because possibly that they think that they may also come down with the unknown illness. But the common disasters or the conventional disasters, bushfires and floods, people normally have in mind when that's going to finish. Right? It's normally short-lasting type in terms of the acute phase of the disaster. Whereas respiratory illnesses and so on can last for quite some time, days to weeks to months to years. And even nurses who have come in contact with patients who have some unknown respiratory illness may need to be isolated themselves. And so you might need to be isolated for 2 weeks, for example. Whereas the bushfire or flood, you could go to work, do a long shift, it might be 12 hours, but then you get to go home again. So perhaps that's a reason why as well. So it came down to things like dependence. So perhaps if there were some solutions around how we could care for people's dependent children or grandparents or parents in the community would free up some of the workforce. Perhaps there's also other large workforces which we don't think about as well, such as volunteers, such as students of healthcare professions. So nursing, doctor, paramedic students could be workforces as well, which we don't necessarily think of or use in disasters.
We've also had an interesting discussion with some of the emergency management personnel who've said that, when it comes to a really large-scale disaster, that very often the first responders are in fact not the authorities. It is the family member, the friend, the person across the road, the person who comes to an accident scene. That we need to start getting the public thinking like they are in fact first responders as well.
Absolutely. If we had a general awareness about what to do in a disaster, and I think that's starting to grow with the prepare, act, survive type slogans, people are starting to think more about that. But commonly we think about that from an individual perspective, about how I can survive myself in a disaster. We don't normally think about it more long-term past the actual event, and we don't normally think about it sometimes in terms of other people in the community. So most streets will have doctors, nurses and paramedics in their street. So it's about how you might utilise or know where those people are in your community, so that if you do get cut off, for example, from a bushfire or flood, that you still know who to access if you need people for life-saving treatment. However, we know also from things such as Cyclone Yasi, when the Queensland government stood up and said, for the next 24 hours, because of the extreme weather events, our emergency service personnel are just not going to be out on the road. Essentially, you need to fend for yourself. So you need to have basic first aid awareness, you need to have basic first aid equipment to be able to care for yourself and your community in that first 24 hours during that extreme weather event. Our emergency services are just not going to be able to stretch to help you, is essentially what they said.
Do you think that, as a country, we need to start taking that whole idea of basic first aid and that kind of thing into the schools and having children start doing that as just a matter of course?
Absolutely.
I mean, we live in a country where bushfires are just the norm.
Yeah. So first aid training is really important because they are the initial life-saving skills. What you do in the first minute to 10 minutes is going to determine the difference between whether someone lives or dies from a first aid perspective. So that's really important. So and there are already programs across the country which are starting to roll out first aid in schools, which is really important. And there's some organisations which have the idea that perhaps we need to have someone in every household trained to a particular level of first aid, or every motor vehicle driver needs to have first aid as part of their licensing renewal and those types of things.